Hey, welcome. Today, we're going to talk about some really powerful, science-backed habits that can actually change the way you age. We'll get into what Dr. Rhonda Patrick calls the low-hanging fruit, simple fixes you can make today, and then we'll get to the more effortful changes that really deliver the biggest rewards. Let's dive in.
So, just to understand how high the stakes are, let's start with this. It's kind of a bombshell finding. We all know smoking is bad for us, right? But what if a simple nutritional issue carried pretty much the exact same risk to your life expectancy? This one piece of data really shows you how critical some of these simple fixes can be. So, let's start with the easy wins. These are the foundational micronutrients that are actually pretty simple to deal with, but they can have a massive impact on the aging process. And honestly, it's especially important because a lot of us just aren't getting enough.
All right, first up is vitamin D. And you have to understand, it's not just a vitamin. It's actually a steroid hormone. It helps regulate over 5% of our entire genome. I mean, it's basically the conductor of an orchestra, telling your genes when to turn on and off. And yet, look at this. About 70% of us have inadequate levels. That's like trying to run a high-performance engine when the spark plugs are all out of whack. This slide really highlights something crucial, the difference between just being sufficient and being optimal. Your standard medical guidelines might say you're fine if you're over 30 nanograms per milliliter. But when you look at these huge studies on all-cause mortality, they find the real sweet spot for longevity is actually between 40 and 60. And really, the only way to know where you stand is to get tested.
Now, for our next key nutrient. To really get why it's so important, you have to realize that your DNA is taking hits, constantly. I mean, right now. Just from breathing, from metabolizing your lunch, you're creating this low-level, invisible damage that just builds up year after year. And that accumulation is a major driver of aging. And this is where magnesium comes into play. Think of it as a critical part of your body's DNA repair crew. It's what's known as a cofactor for the enzymes that do the repair work. So without enough magnesium, that glue just can't do its job right. And considering about half the US population doesn't get enough, that's not that surprising that higher magnesium levels are linked to a 40% lower risk of dying from anything and a 50% lower risk from cancer. Okay, so let's circle back to that shocking quote about omega-3s from the beginning. It turns out having a high omega-3 index, which is a measure of the levels inside your red blood cells, was associated with a 5-year longer life expectancy compared to people with a low index. A 5-year difference. To put that in perspective, that's about the entire gap in life expectancy between the US and Japan, where, by the way, omega-3 levels are much higher. So, quick recap of the simple fixes: vitamin D, magnesium, and omega-3s. These are 3 of the most powerful, measurable, and, importantly, correctable factors for healthy aging. The key is to get tested and aim for these optimal targets.
All right, now that we've covered the simple fixes, let's shift gears and talk about the real power play. Now, this isn't quite as easy as taking a supplement, but if you're willing to put in the work, Dr. Patrick is convinced that vigorous exercise is basically the most powerful longevity drug we have, period.
So how do we actually measure the effect of this drug? Well, the gold standard is something called VO2 max. This isn't some fuzzy questionnaire about your activity level, it's a hard number. It's an empirical measurement that tells us exactly how efficiently your body uses oxygen. And as it turns out, it's one of the single best predictors of how long and how well you're going to live. This chart just lays it out so clearly, doesn't it? If you start out with below normal fitness for your age and sex, even a small jump up to low normal can add over 2 years to your life. Pushing yourself all the way to an elite level, that can add almost 5 years. The big takeaway here is that every single step up makes a real difference. And get this, the difference between the least fit and the most fit is just staggering. We're talking about an 80% reduction in all-cause mortality. Let that sink in for a second. There's no pill, there's no supplement, no diet on earth that can give you a result that dramatic. That's the power of pushing your body.
And here we are again, with that same stark comparison. Just like a low omega-3 index was comparable to smoking, having low cardiorespiratory fitness carries a mortality risk that's right up there with major diseases. We take those diseases seriously, right? Well, this data says we should be taking our fitness just as seriously.
Okay, so the why is crystal clear. It's a huge deal. But what about the how? What's the most effective, most efficient way to improve this critical biomarker for your longevity? While pretty much any aerobic exercise is good for you, the research consistently shows that high-intensity interval training is the fastest way to boost that VO2 max. This here is a well-studied and, brutally effective protocol.
It's 4 minutes going as hard as you possibly can, followed by 3 minutes of active recovery, and you repeat that 4 times. It's tough, for sure, but it literally forces your body to make the exact adaptations it needs to get fitter.
And if you need a little more motivation, you have to hear this. There was a landmark study that took sedentary but otherwise healthy 50-year-olds and put them on a 2-year program of vigorous exercise. And the result? They actually reversed key structural changes of their aging hearts. Their hearts became less stiff, more elastic. They essentially made their hearts look and function like they were 20 years younger. Just incredible. But let's be real, a super intense 30-minute workout isn't always possible every day. So what can you do? Meet the exercise snack. The idea is super simple. Find just a minute or two in your day to go all out. Sprint up the stairs at work. Do a minute of jumping jacks before you make lunch. The goal is just to spike your heart rate and break up those long, damaging periods of just sitting around.
And please, don't underestimate these short little bursts. In studies where they tracked people with activity monitors, they found that just 3 of these 1 to 2 minute snacks per day were linked to these huge reductions in mortality. It's an amazingly effective strategy for anyone out there who says they just don't have time to exercise.
So we've gone through the simple fixes and the more demanding but powerful exercise plays. Let's put it all together into a really clear action plan you can start using, like today.
Okay, so here are your key takeaways. First, measure what matters. Go get your vitamin D and omega-3 levels tested. Second, you have to prioritize vigorous exercise to improve that VO2 max. If you can, use proven methods like high-intensity interval training for the biggest bang for your buck. And on the days you can't, use those little exercise snacks to fight the risks of sitting too much. Look, the science is clear, and the tools are surprisingly right there in front of you. Everything from a simple blood test to a 1-minute sprint up the stairs. The ability to influence not just how long you live, but how well you live, is truly in your hands. So the only question left is, which tool are you going to use first?